is usually checking thyroid function tests, or TFTs. We're mainly looking for an elevated level of TSH, thyroid-stimulating hormone. TSH comes from the pituitary gland, telling the thyroid to work.
Oh.
If the thyroid is failing, the pituitary shouts louder, so TSH goes up.
Okay, high TSH is a big clue.
It's the primary indicator.
Yeah.
Then we look at free T4, the main thyroid hormone. If TSH is high and free T4 is low, that confirms overt hypothyroidism. But you can also have what's called subclinical hypothyroidism.
Subclinical.
Yeah, where the TSH is high, showing the thyroid is struggling, but the free T4 level is still technically in the normal range. It might be an earlier stage.
And those antibody tests you mentioned earlier, they must be important too.
Oh, absolutely crucial pieces of the puzzle. Finding specific thyroid antibodies strongly points to an autoimmune cause. Anti-TPO antibodies, it's anti-thyroid peroxidase, they're positive in like 90 to 95% of cases. Very high percentage.
Wow.
And anti-TJAG antibodies, antithyroglobulin, are also found pretty often, maybe 60 to 80% of the time. These are really key diagnostic markers.
Are there other things in the blood work that might hint at it?
Sometimes, yeah. For instance, cholesterol levels might be elevated because of the underactive thyroid, or sometimes anemia can show up too, either normocytic or macrocytic type.
What about imaging, like an ultrasound? Does that help?
Imaging can definitely provide supporting evidence. A thyroid ultrasound often shows characteristic features. The tissue might look hypoechoic, darker than normal on the scan, and heterogeneous, meaning uneven, sometimes with things called pseudonodules.
Okay.
Blood flow, the vascularity, can also change depending on the stage, might be higher during inflammation, lower later on. There's also a radioactive iodine uptake test, or NRAIU.
What does that show?
It checks how much iodine the thyroid takes up. In Hashimoto's, the results can vary a lot, reflecting that sort of changing activity level of the gland.
And if, for some reason, a biopsy of the thyroid is done, what would pathologists see?
Right. If they look at the tissue under a microscope histopathology, it can give a definitive confirmation. They'd see that lymphocytic infiltration we talked about, those immune cells packed in there, along with something called Hürthle cell changes and fibrosis, the scarring.